Dear students, you are welcome again in the course of Diagnostic Microbiology. Today I will talk about blood culture. As you know, blood is sterile, and one of the problems facing the lab worker are the low number of the microorganisms that can be isolated from blood sample, which provide the false negative problem. البلاد هو sterile body fluid any microorganism can be found in blood is considered as a pathogen or infecting for this sterile body fluid. One of the main problems which face the researcher when doing blood culture is the false negative. These false negative results may be due to low number of microorganisms. From this point, many precautions must be taken when culturing the blood. We must have an idea about the organism which may cause blood infection, although any organism whether pathogenic or not can cause blood infection. أكيد إحنا كمايكروبيولوجيست لازم تكون عندنا الفكرة الكافية أنه هو شنو ما هي المايكرو أورجانيزم اللي ممكن تعمل لي البكتيريميا اللي هي presence of bacteria in the bloodstream or septicemia, the presence of toxins of bacteria and their toxins, presence of microbes also and their toxins in the bloodstream. What's the type of microorganism, whether pathogenic or not pathogenic? What is the aim to doing blood culture? Why we use blood culture? When and where we use blood culture? An histological diagnosis of bacteremia by aerobic and anaerobic cultivation of the blood with identification and susceptibility tests of the isolated organism. Then the main purpose for doing blood culture is to isolate the causative microorganism and doing antimicrobial susceptibility tests for this pathogen. Blood culture should be made for cases with suspected septicemia, endocarditis, and bacteremia secondary to localized infection like pneumonia, intra-abdominal abscess, pyelonephritis, epiglottitis, meningitis. In this case, a blood culture may provide an histological diagnosis of localized infection. Now, what is the type of specimen for doing blood culture? Normally, it's blood. It's whole blood, okay? What are the criteria for specimen rejection? First, blood collected in tubes or bottles other than aerobic and anaerobic blood culture bottles. يعني احنا عندنا specific bottles for doing blood culture, either aerobic or anaerobic. The other bottles must not advise to be used because these bottles اللي هي as laid down or as manufactured by the specific company هي تكون specified for blood culture, either aerobic or anaerobic. If the information on the label does not match that of the request form, يعني البيشنت عنده questionnaire ومسجل اسمه فلان، لكن احنا لما نيجي نشوف الليبلز الموجود على البوتلز يختلف الاسم، هنا راح يبدا عندنا شكوك انه ممكن يكون هذا يعني ماكو ماتشنج بين الكويشنير شيت وما بين الانفورميشنز اللي هي fixed on the label of the bottle. Specimens for anaerobic blood culture received in aerobic bottle or vice versa. طبعا عندنا blood cultures واحد من عندنا specific للايروبيك condition والأذر for anaerobic conditions. ما ممكن البلاد كلتشر في aerobic نودي للانايروبيك والانايروبيك نخليه اللي احنا نطمح منه anaerobic culture نضعه في البلاد في البوتلز اللي هو specific for aerobic culture or vice versa. Now we must be aware of what are the common pathogens for doing bacteremia. As you know, bacteremia, septicemia and sepsis, septic shock, sepsis followed by septic shock. Bacteremia is the presence of bacteria in their bloodstreams, and the common pathogens are Streptococcus species, Staphylococcus aureus, Listeria monocytogenes, Corynebacterium jejunum, Haemophilus influenzae, Salmonella typhi, Bacteroid fragilis and other anaerobic bacteria, coagulase negative Staphylococci, enteric gram negative bacilli, Neisseria meningitidis, non-fermenter gram-negative bacilli in addition to Pseudomonas aeruginosa. All of these are common bacterial pathogens may be found in the bacteremia. The parasitic infection, parasites can be found as transiently into the blood مؤقتا in the bloodstream. For example, التكيزويدز of Toxoplasma gondii اللي هي causative agents of toxoplasmosis. It's found transiently on the blood. Thus, the blood specimen is not the specimen of choice for doing molecular diagnosis for extract and amplify the target gene from the human genomic, because the parasite is found in the blood transiently. Okay? Viruses, virus, human immunodeficiency virus, cytomegalovirus, and other human retroviruses. Fungal causes include Candida albicans, especially in immunocompromised patients, Cryptococcus uniformis, other Candida species, Coccidioides limitis and Histoplasma capsulatum, and the fungal infection already occurred in the young and the older and in the immunocompromised patients. Now, after well and clear defined the bacteremia, what are the types of bacteremia? Bacteremia may be transient, continuous, or intermittent. Transient مثل ما أخذنا parasitic infection, for example, Toxoplasma gondii. That means the microbe, either bacteria, parasite, fungi, and blah blah blah, may be found transiently in the blood. Okay, continuous or intermittent متقطع. The two major categories of bloodstream infection are intravascular, who they originate within the cardiovascular system, and extravascular, who originate from the bacteria entering the blood circulation through the lymphatic system from another site of infection. Now, there are several factors for successful blood culture. What are these factors? First, type of anticoagulant used. As you know, for each blood culture experiment, the anticoagulant used must be selected precisely, بدقة. There are many types, but the most effective one is the sodium polyanethyl sulfonate, because this substance, SPS, sodium polyanethyl sulfonate, has the following characters. First, it inhibits blood clotting. It neutralizes the bactericidal effect of the serum. It prevents phagocytosis. It partially inactivates certain antibiotics like streptomycin, gentamicin, mixin B. And the last one, the most important feature, is its stability at autoclaving. All of these are the suitable factors for SPS to be the most common and successful anticoagulant use in blood culture. When handling blood sample, it should not be collected because the clots, it must not be clotted, because the clot provide a site for bacterial hiding and multiplication inside the clots, and thus making them inaccessible to the examination. يعني احنا هذه من البروبلم المهمه حقيقه اللي تواجه باحثين وطلابنا، انه من يكون قدامي كلوتد. لذلك احنا راح ناخذ لاحقا، اعتقد في نفس السلايد، راح شلون نتعامل مع الكلوتس. يعني اذا انا جاني البيشنت من مكان بعيد وانا مضطر اتعامل مع البلاد كلوتس، البيشنت ما متوفر، ما موجود، والحاله كلش صعبه، انه لابد ان نتعامل مع الحاله السريريه. طبعا clinical status for the patient is so critical and we must handle with the clotted sample. How I can handle with this clotted samples? First, the circumstances as I describe. After the blood aspiration, the laboratory man is delayed Now the patients are receiving antibiotic course. Of these cases, the clotted blood samples are processed as follows. First, the sample is mixed with sterile glass beads in a sterile container. إذا هذا الكلوتد blood ممكن نعمل مع mixing للsterile glass beads، بالتالي يعمل لي destruction للجلاس beads، يعمل لي destruction، بالتالي يعمل لي disturbances for clotting and releasing of bacteria in the blood. Second, by shaking, the clots are broken into the tiny pieces, then the blood is distributed into different culture media bottles. Now, the blood culture should be drawn prior to initiation of antimicrobial chemotherapy. This is the most important one. Before doing any blood culture, I must question the patients or the partners of the patients. Does the patient receiving antimicrobial chemotherapy at the last 72 hours? If this occurs, please to delay taking the specimen until the patient has been stopped the antimicrobial chemotherapy for 72 hours. If more than one culture is ordered, and the specimen should be drawn separately, no less than 30 minutes apart, to rule out the possibility of transient bacteremia by self-manipulation by the patients of mucous membrane in the mouth, or by local irritation caused by scratching of the skin, and blah blah blah. Now, the number of bacteria are generally higher than in acute initial stage than the chronic or later stage of the disease. Thus, the false negative culture for the chronic state may be due to the number of microorganisms at the chronic stage is lower than those observed in the acute or initial stage. And small children usually have a higher number of bacteria in the blood than adults. The number is also higher when the fever rises than when it's falling. Okay, so a number of bacteria in the blood of the baby, of the child, are usually higher than those of the adult. This interprets why we take smaller amount of blood from the child when we're doing blood culture, because the high number of bacteria in the small amount of the blood. The number is also higher when the fever rises than when it is falling. لذلك احنا عادة من نروح intensive care unit أو الهوسبيتال بسهولة، ان احنا ممكن نعمل drawing for blood when the patient is feverish, because at the fever the bacteria will multiply inside the white feces and or inside the bloodstream, and thus the chance for taking a false positive may be higher. For patients expected to seed bacteria intermittently into the blood, 80% of these are detected with the first culture and 99% within the 3 cultures. Now, before starting antibiotic therapy, if time permits, it is generally recommended that the first 2 sets of blood culture be taken 1 hour apart and the third after 3 to 6 hours. إذن هنا من يكون أنا عندي الاستراتيجي for antibiotic therapy، إذا الحالة تتطلب according to the advice for the supervised clinician، ممكن أعمل 3 times for blood culture, for blood specimen, for taking the blood specimen. The first 2 sets of blood culture be taken 1 hour apart بين ساعة وساعة, and third set after 3 to 6 hours to increase the chance for false positive culture. Obtaining the blood culture 1/2 hour before a temperature spike is ideal, because the highest concentration of organisms are circulating at the time. Because the temperature spike, يعني أعلى صعود الحرارة, is usually an unpredictable, uneducated guess must be sufficient in most cases when timing blood culture. Now, what are the volume of blood taken according to the age of the patients? and the patient's age below than 2 years, 1 ml of venous blood in 2 bottles. 2 to 5 years, 2 ml of venous blood in 4 bottles. 6 to 10 years, 3 ml of venous blood in 4 bottles. As you show here, at these 3 ranges, the smaller amount of blood will be increased with the increase of the age. But because why? Because why we use here a low amount of blood? Because the bacteria number is higher in the child in comparison with adult. In the children 11 to 15 years, 5 ml of venous blood in 4 bottles. And the children above 15 years, an adult, 5 ml venous blood in 3 set of bottles. يعني راح يكون عندي بالمحصلة 6 bottles. Okay? During a blood culture collection, in all precautions should be taken to minimize the percentage of contaminated blood culture to reduce the chance of contaminating organism from the skin. The vein puncture site should ideally be prepared as follows. Wash with soap. كيف يعني أفضل طريقة إنه نعمل specimen collection? Firstly, wash with soap, rinse with sterile water or saline. Second, apply 1 to 10% tincture iodine or povidone iodine and allow drying for 1 to 2 minutes. بعدين after that راح نعمل removing الأيودين ونخلي 70% من الالكحول. Why 70% not absolute alcohol? Because 70% is lipid dissolvent and protein denaturant. As you know, the plasma membrane of the bacterial cell walls consists of lipid and protein. 70% will denature the protein and dissolve the lipid, while absolute alcohol has not capability for lipid dissolving and protein denaturing. If the site again the place the palpated after the iodine alcohol preparation, the finger must be disinfectant or sterile gloves warm. Okay, a tourniquet is applied to the upper arm above the vein puncture site to distend the antecubital veins. Remove remove flip caps, okay, from the tops of the selected culture as you show here. Disinfect the septa of the bottles with alcohol or iodine preparation and allow to divide. Perform vein puncture as you show here with syringe and collect the desired amount of blood. If the vein is missed, الوريد ما واضح يختفي, a new needle should be used. Okay? يعني other trial with other syringe. Transfer the recommended amount of blood into the blood culture bottle as you show vertically عموديا. First, fill the aerobic bottle. Do not overfill the bottles. Any remaining blood may be used for additional tests. Okay? Label the bottles according to the routine procedure when using sticker. Do not cover the tear off section of the barcode label as you show here. Specimen processing. The bottle incubated for 24 hours before plating to enhance the growth of bacteria. Aerobic bottle plate on blood agar. Macon key, chocolate and carbon dioxide. Incubating 24 hours. Anaerobic incubate anaerobically. Anaerobic incubate anaerobically on blood agar for 48 hours. And the negative bottle should be re-incubated and the test for after 10 days before discarded as negative culture. يعني احنا ممكن نعمل بشكل متوالي يعني بحالات الضرورية يومين 4 أيام 6 أيام 8 أيام كلنا نفحص الكلتشر لكن no negative report till after the passage of 10 days. If slow growing organisms are suspected as Bacillus species, it should be clearly indicated on the question form, and the culture bottle should be further incubated for 2 to 4 weeks before being reported out as negative. ليش؟ لأن البروسيلا هي slow growing microorganism لذلك نحتاج احنا أن نعمل لها blood culture for longer incubation time. blood bottles either aerobic or anaerobic. Aerobic bottles, for example, trypticase أو tryptic soy broth والفلويد ثايروغليكوليت ميديا. ليش الثايروغليكوليت ميديا؟ لأن الصوديوم ثايروغليكوليت الموجود بها هو الحقيقة هو يعمل الصوديوم ثايروغليكوليت يعمل كريديوسينج ايجنتس، يسحب الأكسجين، ذاك يكون انيروبيك بوتلز. هنا راح يكون طبعا aerobic bottles. البث two bottles either aerobic or anaerobic contain sodium bonylethal sulfonate as you show here, and is very important anticoagulant use for successful blood culture. The sodium bonylethal sulfonate, as I mentioned previously, the anticoagulant in the blood culture medium must harm the bacteria and must prevent the clotting of the blood, which entrap bacteria and prevent their detection. The most commonly used preparation in blood media is 0.025% to 0.05% SBS. In addition to its anticoagulant properties, sodium bonylethal sulfonate is also anti-complementary, anti-phagocytic, and interfere with the activity of antimicrobial agents. And I mentioned previously in this lecture with details the advantage for using SBS, as you show here, as the chemical signature. These are the blood bottles for anaerobic, as you show here on the left, and here the white aerobic blood culture bottles. Okay. Blind subculture syringe and drip methods, as you show here, the aerobic bottles, in both of them, gram stain is very important to detect the causative agents, either gram positive or gram negative. The result of a gram stain give me a preliminary test for the culture and the suspected, the suspicion. What's the suspicion of the causative organism? The gram stain. After that, the bacteria from the aerobic and blood from the aerobic bottle will inoculate into blood agar, chocolated Macong agar, and in anaerobic it is inoculated into the blood agar. Okay. These are the incubators for a blood culture. Okay. How to culture an intravenous catheter trip. كيف ندخل intravenous catheter trip؟ طبعا يعني بشكل واضح جدا. شفنا كيف يصير عندنا when colonization of an indwelling catheters. هذا الindwelling catheters المدفوع بالداخل is suspected of being the focus of septicemia. The catheter tip may be cultured to determine its status. احنا عادة مجرد هو احنا الكاثيتر مجرد ندخله واحنا نخلق الانفكشن، لكن طبعا هو اكيد من الكاثيتر هو الاستخدام الطبي المهم له، لكن بنفس الوقت احنا هو نصنع we are create the infection itself. اللي هنا شيء يصير حتى اذا انا بديت اقلق انه ممكن يصير عندي بكتيريا septicemia due to catheterized infection، نعمل من هنا شوف هذا الكاثيتر شو يصير. الكاثيتر tip may be cultured where into the culture media. After overnight incubation, the colonies are counted. Opposite culture result with greater than 5 CFU, 5 colony forming unit per mole. هاي الطريقة نقطع الكاثيتر ونزرعه بشكل 5 سنتيمتر. اوكي، بعدين نعمل طريقة rolling 4 to 5 times across the surface of the agar plate. Okay, when we showed more than 5 colonies, it is considered positive. The interfering factors patients on antibiotic therapy is the most interfering factors for the successful blood culture. Turn around resulting reporting any associated organism will be reported. Why? Because blood is sterile body fluid, and any organism must be found. It's considered pathogens. But we must differentiate between contaminant and true pathogen. When we have different colonies with similar morphology, it is indicated it's true pathogen. But different colonies or many colonies with different morphology, that's considered contamination. Turnaround time. Initial blood culture result will be reported as soon as it shows growth. Final results with sensitivity will be issued after 24 to 30 hours of final initial report. Negative results will be issued after 10 days of culture submission. The examination of blood culture. First condition for incubations. After incubation, the bottles after incubation, the plate at 37 centigrades with cap of the culture media losing 5 to 10% carbon dioxide, because certain blood pathogens are carbon dioxide dependent, like H. influenzae, Streptococcus pneumonia, and serum meningitis. The blood culture incubated for 5 to 7 days unless it's specifically indicated by the physician, like Brucella. Brucella يحتاج maybe reached 1 month. Okay. In manual system, the blood culture bottles are examined 2 to 3 times after for the first, second day of daily, thereafter for a week. The number of blood specimens that should be drawn for culture and the blood time over which the done depends in part upon the severity of the clinical illness. In hyperacute infection like gram-negative sepsis with shock of or staphylococcal sepsis, it's appropriate to culture 2 blood specimens obtained from different anatomic sites over a period of 10 minutes. In other bacteremic infections like subacute bacterial endocarditis, 3 blood specimens should be obtained over 24 hours. Okay. Appearance of a broth. How can I suspect the type of microorganism according to the appearance of a broth in the blood culture? If we show uniformly homogeneous turbid layer above the red blood cells layer, gas bubble may be found. It is indicate the gram-negative roots. من نشوف البلاد كلتشر بروسس طبعا راح يصير الار بي سي sediments راح تكون in the bottom of the bottles. لذلك من نشوف uniformly homogeneous turbid layer طبعا uniformly homogeneous turbid above the red cell layer, it's considered gram-negative roots. In case of meningococcus and pneumococcus, meningococcus mean Neisseria meningitidis, and pneumococcus pneumonia caused by Streptococcus pneumonia. Meningitis caused by Neisseria meningitidis and pneumonia caused by Streptococcus pneumonia. It produces less turbidity and usually accompanied by greenish tint in the media. نشوف بشكل واضح green discoloration أو greenish tint موجودة بشكل واضح بالميديا. هذا معناها احنا عندنا ألفا هيموليتيك ستريبتوكوكاي من النيموكوكاي ممكن نشوفها بشكل واضح أيضا. In case of streptococcal infections, we can show cotton ball colonies. كرات قطنية colony تشبه الكرات القطنية موجودة على on the top of the red blood cells. بنشوف هيك شكل cotton ball colonies, that means streptococcal infection. While the upper layer of the media remain clear. This occurs in case of subacute bacterial endocarditis due to alpha hemolytic streptococci. If the causative organism is beta hemolytic streptococci or any other alpha hemolytic organism, hemolysis of the blood will appear together with the turbidity. And in case of staphylococcus infection and due to Staph aureus produce coagulase enzyme, thus jelly-like coagulum throughout the broth due to coagulase production from Staphylococcus aureus infection. Thus, jelly-like coagulum appear in the broth of blood culture bottles suffering from staphylococcal infection. The interpretation of positive blood culture. Virtually any organisms, including normal flora, can cause bacteremia. A negative culture result does not necessarily rule out the bacteremia. طبعا لأن ممكن يكون false negative results occur when pathogen fails to grow. من يكون number of microorganisms is low. من يكون patient and antibiotic therapy. كلها تعطيني false negative culture. A positive culture result does not necessarily also indicate bacteremia. ممكن تكون contamination. واللي هو transient bacteremia ممكن contamination جاي من السكين during the blood specimen collection, or the major source for contamination in the blood culture. Gram-negative bacilli, anaerobes, and fungi should be considered pathogen until proven otherwise. The most difficult interpretation problem is to determine whether an organism that is usually considered normal skin flora is true Now, what are the limitations in المحددات للبلاد culture? 3 negative sets of blood culture in the absence of antimicrobial therapy are usually sufficient حتى نقول هذا to exclude the presence of bacteria. إذا حتى نستثني وجود البكتيريا، نقول انه ما عنده هذه البكتيريا، هذا يكون عندي 3 negative blood culture bottles والبيشنت ما ياخذ انتبيوتيك، يعني under standard condition فهذه exclusion للبكتيريا. One set is seldom over sufficient. Prior antibiotic therapy may cause negative blood culture or delayed cone. Blood culture from patients suspected of having Brucella or Leptospira must be requested as special culture. طبعا ليش؟ لانه احنا عندنا البروسيلوسيس والليبتوسبيرا انفكشن تحتاج specific or special culture condition like carbon dioxide, enrichment media, selective media, and blah, and extra. Yeast often are isolated from routine blood culture. However, if yeast or other fungi are specifically suspected, a separate fungal blood culture should be drawn along with each of the routine blood culture specimens. All of these are limitations for the blood culture. Okay? Mycobacterium avium complex is frequently recovered from the blood of immunocompromised patients. In immunocompromised patients, we can easily show the Mycobacterium avium, particularly those with acquired immunogenicity syndrome. The AIDS special procedures are required for the recovery of these organisms. This represents the Castanida biphasic medium. Where I can use Castanida? I can use Castanida for the culturing the blood from the patients with high suspicion of brucellosis, because here I have 2 types of media: solid media, as I show here, and liquid media. For example, brain-heart effusion agar, brain-heart effusion broth. Thus, when we inoculated the blood from here for 5 ml, alteration of the bottles and incubated at the incubator, after 15 days, no positive culture will remain after 15 days. The advantage for use Castanida blood culture system here for brucellosis, firstly, to reduce the risk for transferring the brucella to the brucellologist or laboratory man during opening the cup. Second, and to reduction the incubation time from 1 month, the well standardized بالبروث only إلى 15 days, يعني half the time. Okay, this Castanida biphasic medium. Why it's called biphasic? Because 2 phases of culture media, solid and broth, is observed in the Castanida. That is all regarding the blood culture. Dear students, I hope you are interested in this lecture. Please do not hesitate if you for any inquiries. Thank you again.